Good late morning or early afternoon to all of you. We're getting our panelists up here and then we'll get this show on the road. Thanks for your patience.
We're just waiting for a few more speakers. We will start shortly. Just waiting for two more speakers and we will start shortly. Thanks so much for starting your morning or afternoon with us.
Still getting some panelists up here, folks. We'll be starting very shortly. Thank you for your patience. All right, everybody, while we start and continue to get our panelists up here with some of these connection tidbits we run into with every panel, it seems, I'm going to go ahead and start us off with some introductions today. So welcome, everyone, as always, to our Unusual Whales panel. Today we'll be focusing on healthcare stocks and how an RFK Jr.-led Department of Health and Human Services may affect the sector, the economy, and healthcare as a whole. This panel is sponsored by TEMA ETFs, who manage an array of funds, including the HRTS, GLP-1 Obesity, and Cardiometabolic ETF that we've had a panel on before in the past. You can check them out to see more directly from TEMA about all the funds that they manage. Now, those of you who have attended our spaces before know that I like to keep these panels wide open for discussion, especially ones like this that are seemingly wrought with controversy, opinions, different takes from all sides of the equation. So, as we go along, panelists, please feel free to chime in when you've got something more to add. The only request that I have is that we keep all microphones muted when someone's speaking, just to avoid any overlap or audio feedback. And sometimes the Twitter spaces will cut out the initial speaker if someone else starts talking entirely. So if we can just avoid that, that'd be great. Just give it a little breath of air in between each speaker before you jump on in. To our audience, as we will be discussing the potential of an individual investments on this panel, it's important to note that each of your individual circumstances are different, so you need to make sure that you read about each investment carefully so that it fits your risk and return profile. Also note that nothing said in this space should be construed as actionable financial advice or a solicitation to buy or sell any security or derivative. Always conduct your own research or discuss with your licensed financial advisor before making or taking any given investment. Now, with all of that out of the way, let's introduce some of our panelists that were able to join so far. Starting us off here, we have Yuri Kojimirian, the CIO of TEMA ETFs, today's sponsor. Yuri has over a decade of experience managing UK and global portfolios, and he co-managed the Magity Fund, raising several $1 billion in assets. And in previous panels, Yuri's input has been extremely insightful from the perspective of an investor. Thanks for coming, and as always, Yuri, thanks for sponsoring this panel and making it possible.
Thanks very much. Looking forward to the discussion.
As am I. I think this one's going to be a hot commodity of a panel. Next, we have Dr. Eric Feigl-Ding, a public health scientist and epidemiologist currently serving as the chief of COVID task force at the New England Complex Systems Institute. He's also the chief health economist at Microclinic International and the co-founder of the World Health Network. His research and works have heavily focused on obesity, nutrition, and cancer prevention, and we're extremely grateful to have his expertise and his input here today. Welcome, Eric. Thank you for coming.
Thanks. Happy to be here.
Up next, we've got Dr. Jason Fung, a well-versed and rightfully renowned for his work in disease prevention. He's often called the founder of intermittent fasting. Dr. Fung has prescribed intermittent fasting and low-carb, high healthy fat diets for the management for and even the reversal of type 2 diabetes. He's authored numerous books on disease prevention, such as The Cancer Code, and we're honored to have him joining us today. Welcome, Jason.
Thanks for having me. Glad to be here.
And glad to have you. Next, we've got Dr. Jesse Morse, a board-certified family and sports medicine physician, and many of you may know him for his expertise in sports injuries and his work with the injury experts. Dr. Morse's treatments combine traditional orthopedic medicine with regenerative medicine, and he's extremely passionate about getting to the root of health issues, exploring effects on the immune system, as well as those from toxins. Excited to have you here today. Welcome, Jesse.
Thank you very much for having me.
And we'll have a few other panelists hopefully joining later on as we kind of get into the swing of things and get things set up. So to get right into this, The initial market reaction to the RFK Jr. nomination has been pretty negative across the biopharma and healthcare sector. So I'm curious, Yuri, could you tell us a little bit about this reaction and kind of what your read is as to why? I'd love your thoughts.
Yeah, absolutely. I mean, it's been very interesting to watch. I think there was an initial positive reaction to the Trump election in the healthcare markets and biopharma markets. Generally, the Democrats are seen as a bit more negative for healthcare. They've been quite vocal on things like drug pricing, other areas as well, and have led the previous big reform efforts. But so that was the starting point, and then everyone was shocked with the nomination for healthcare secretary of Robert Kennedy. I think there's a lot of uncertainty, and as we all know, the stock market hates uncertainty, and the reaction was quite violent and quite quick. There was some changes under the surface, which we can discuss, but really all healthcare stocks sold off, apart from medical technology, interestingly, which was seen as a little bit of a bolus, a sort of I guess a safe port in the storm. And this sell-off has created what looks like a pretty amazing valuation opportunity that we've not seen. The discount of the S&P healthcare sector relative to the S&P 500 is about 21%. And you've seen this kind of level of discount in previous reform efforts. So we're talking about, so-called Hillary Care in the 90s and Obamacare, of course, most famously with the passing of the ACA. So the situation is one where the market has, to use a kind of common term, shot first and is now trying to ask questions later. And that's the situation we find ourselves in. And it's an interesting situation because it really is it's a very, very, very attractive valuation opportunity if the risks don't prevail as the market thinks.
Thank you, Yuri. Does anybody have anything to add to Yuri's points there before I plug us right along? All right, so I'm going to jump right into the thick of things. I want to start off here with one of RFK Jr.'s stances that has been a major topic of controversy and discussion, that being his commentary on vaccination. RFK during the pandemic made claims that the COVID-19 vaccines were, quote, the deadliest vaccines ever made, and he's made similar statements regarding polio vaccines, claiming they lead to cancer directly. Controversy notwithstanding, I'm going to pick on Yuri again before we kick to the rest of the panel. Should RFK make any major changes in vaccine enforcement or regulation, what might we see in stocks that heavily rely on vaccines for their profitability, such as Pfizer?
Yeah, so this is one of the things that's sort of happening under the surface, and it's related to analysis of, I would say at this point, rhetoric and kind of press analysis. There's a website which is Make America Healthy Again. There's also various Twitter posts by Trump and press interviews with Kennedy. And this is really what we have to go by. So I would say one of the main things for everyone to be aware of is there's just a lot of uncertainty about how these policies will look, especially when these individuals are in place in policy making positions. Things change a lot. And things get dampened down especially as we go through the nomination process, which can be quite lengthy. But if you look at vaccines specifically, I think there's a fear in the marketplace that vaccines are going to be affected most. There's a lot of skepticism, not just by Kennedy, but other members of the incoming Trump administration of vaccines as a medical intervention. I think probably from our perspective, we think that there is probably going to be a more negative stance of the policy on vaccines. Now, Kennedy's already softened his position by saying, I'm not going to take away choice of vaccines. But what it probably means is there's going to be less, let's say, funding of infectious vaccine development, more stringent requirements, et cetera, et cetera. And that is likely going to hurt companies that have vaccines as a major part of their pipeline. So one of them is, for example, Moderna, which relies quite heavily on vaccines as part of its pipeline. And so we think broadly, the most important thing to watch for in terms of long-term stock impact for the healthcare sector is innovation. This is what is the lifeblood and the driving force of healthcare. And within the vaccine space, our concern is that innovation might be stifled, at least over the next couple of years. But as I said, a lot of uncertainty, things remain quite fluid.
Thank you, Yuri. I think a really good point there, especially in the case of Moderna. So I kind of want to follow up on that a little bit to look at this from a societal health point of view. What kind of connotations would come with regulatory changes in the world of vaccines? Eric, you've been extremely vocal on the topic of vaccine misinformation. What are your thoughts on the prospect of shifting regulations under RFK's HHS, especially as we're seeing a significant drop in vaccinations with significant rises in diseases such as pertussis, also known as whooping cough?
Yeah, thanks for having me. Obviously, my views on RFK are not very, rosy, and to say the least, because we know he's been, having founded Children's Health Defense, which is basically makes him the king of anti-vax and responsible for so many misinformation and, for example, also the outbreak in Samoa that killed 83 people with their outbreaks of measles. And I think pertussis also being 5x higher in 2024 alone versus 2023, and the year's not even done yet, and so many other potentially worrisome trends in the vaccine. Because whenever he says, "Oh," and I've seen his pivot. We're not going to, you know, we're not going to ban vaccines. You can still get your vaccines if you want to. What that means is basically he's implying that he's probably gonna drop all mandates. And the issue is we have so many vaccine basically mandates for children to attend school, public school, that I really worry because we're already having been on a downward trajectory in terms of pediatric vaccinations. We're talking about beyond just COVID, obviously, vaccines, but the drop in pediatric vaccinations across the board, not just in US, but worldwide. And this is what's causing a lot of these outbreaks. And I worry that, for the return of many of these diseases. And sometimes we've darkly joked, RFK Jr. is gonna try to make iron lungs great again. Well, for those who don't know, iron lungs is the old these breathing machines that before the advent of polio vaccinations that young kids had to rely on to live. I think it will be devastating across the board for so many things, and I think it's not just vaccines. And like, just to be honest, his misinformation extends across so many different things. We also have the debate around fluoride, obviously. We also have the debate around seed oils. And, I'm both an epidemiologist and a nutrition scientist. And whenever I hear seed oils, it's the strangest thing. Like, there's not even normally an industry behind seed oils, other than, for example, you can say corn and uh for example, canola is the rapeseed oil, and many other industries that I don't even understand why this is even discussed, because there's no good evidence that says um seed oils are bad. But so many changes will be out, and obviously many of you have also heard about overnight the the rules around Biden administration saying that Medicare, Medicaid should cover obesity drugs such as Wegovy and Zepbound, which are the high dose versions of Ozempic and Mounjaro, semaglutide and tirzepatide. I think that is going to get into a big fight because this Biden rule is obviously going to possibly be overturned by RFK Jr.'s HHS. And although what's interesting is we know that RFK Jr. might oppose these, coverages, but Dr. Oz, who actually oversees CMS, he's actually been favorable for these drugs before. So there's going to be some internal clashes as well. But I worry again about this, as mentioned earlier, about this absolute chaos because there will be many competing interests. Um, um, of pro science and some of the anti unconventional things that's not supported by science. And also, we don't even know who the NIH director is. What's interesting is, some people say it could be Jay Bhattacharya, but also it could be Operation Warp Speed head Monsef Soluri, which will be very interesting because he was behind the mRNA um, and the COVID vaccine push. So I'd be surprised if they do select him, although he has been named as a finalist for NIH director. So there'll be kind of like many warring potential positions in which people under RFK Jr. actually oppose many of RFK Jr.'s stances. And the question is, will he intervene to basically overrule some of the scientists? Or will he kind of stay out of it? Because we know that RFK Jr. is not the most reliable person in terms of management of many things. So, anyways, I'll let some of the other speakers chime in, but there's going to be a lot of chaos in how a lot of these policies are managed and, of course, funded.
For sure. And you touched on a ton of points there, Eric, that I'm definitely going to get to in here, but just kind of let's piggyback off of that major policy directive that Biden's proposed in regards to Medicare and Medicaid covering obesity medications like Novo Nordisk's Wegovy, as mentioned, or even Eli Lilly's Zepbound. Now, although the timing seems to kind of indicate that, as Eric said, the Trump administration would also kind of need to endorse this, the odds of that kind of up in the air. But Yuri, how would companies such as Novo Nordisk be affected should this go through? Should Medicare cover the cost of these medications for patients? And how would funds such as Tema's GLP-1 obesity ETF react to such a change?
Yeah, absolutely. Now, I just want to echo what Eric said. I think one of the other areas of kind of how this develops is obviously the other individuals involved in the various agencies within the health service. The FDA head, is a former surgeon. We've also got Vivek Ramaswamy, I'm hopefully pronouncing that correctly, who's a former biotechnology executive, and he's part of the Department of Government Efficiency. He's actually tweeted several times in support of biopharma innovation. And I think that's the important driving factor here. I think there will be, as Eric says, maybe chaos, but also counterbalancing forces to some of these policy initiatives. And so the way we see through this is what's probably going to stay intact is innovation. And this brings me to the discussion of obesity drugs. Of course, if you read the press, I think RFK's position is very much the source of chronic disease is diet and should not be medicated, and that these, effectively making negative statements about obesity drugs. What's quite interesting about the obesity space, though, over the last couple of years is companies in the forefront, like Eli Lilly and Novo Nordisk, have effectively gone out and done major trials to try to establish the relationship between GLP-1 and other comorbidities to obesity. So instead of saying weight loss is enough, they're going out and proving that GLP-1s have a positive effect on cardiovascular risk, liver disease, kidney disease, lots of other areas as well. And this is proven in clinical trials. And this they are using to shift the paradigm of doctors into at least treating the patients with comorbidities. I genuinely think this particular area is going to be safe within the paradigm. Effectively, if you're treating a disease, I think there's a view that it should be covered, at least by payers, if not government payers, but then insurance payers. But we're up for a fight here. If the tone at the top is don't cover obesity drugs, and this is really a watershed moment because historically government agencies and government payers have never covered drugs just for weight loss. This will be interesting to see if this gets repealed. But broadly, this is a positive environment for companies that are focused on innovation, on bringing patient benefit, and we think benefits the leaders in the space like Novo Nordisk and Eli Lilly.
Thank you, Yuri. Jason, you actually have a book called The Obesity Code: Unlocking the Secrets of Weight Loss. And so I'm curious, with your expertise and in your current practice, you're very set on utilizing these dietary changes to improve lifestyle, to improve overall health. What are your thoughts on that GLP-1 landscape currently, as well as this propensity of Medicare and Medicaid covering such treatments?
Yeah, I think that they're not at odds with each other because certainly the medications, they help weight loss. We know that. And when you lose weight, there's actually all kinds of other health benefits. So that's all good. Can people do it without the drugs? Certainly, but a lot of people can. So therefore, it's a useful drug, which is fine. It doesn't mean that you shouldn't follow a healthy diet. I mean, I think they just go hand in hand. The real issue is who's going to pay for it. I think that's the real the real problem more than anything else. So I'm not against the medications, but the as with most medications, the American public generally is the one that gets completely screwed because the medication costs are so much higher than in almost every other part of the world. And that's true for almost all medications. So you cross the border into Canada, and a lot of the prices of Zepbound and those other drugs are like, 50% off, 70% off compared to what you get in the United States. So, this is one of the things that, I actually like the RFK appointment very much because he's asking a lot of questions that are not asked. People like to label him, oh, he's an anti-vaxxer, without listening to his actual arguments about what it is that he's questioning, or saying, oh, he's just pumping in misinformation. I'm like, have you heard what the government's been talking about? All these things that they put out that turned out to be completely false as well. So to pinpoint him as a source of misinformation, you have to say, well, what about Fauci? He said all these things that turned out to be not true. There's all these things about the vaccines being utterly 100% safe. And then we found all this myocarditis. Then there's all this, oh, the COVID vaccine will prevent transmission. You'll never get it again. And that turned out to be utterly false. 2 weeks to say, like, there was all this misinformation. So that's not unique to RFK. But what he's doing, which I like, is asking the hard questions like, why should vaccine makers be indemnified? Right? A vaccine is like any other drug. There's risks, there's benefits. If you hurt people, you should get sued. You can't do that with vaccines. So that's one of the good questions. Like, why do they get this sweetheart deal where they make somebody suffer if there's a side effect, yet, say with myocarditis, but you can't sue them? That's why they're running away with all this money in the bank, because they're pumping out a drug. And a vaccine is like any other drug. There's risks and there are benefits, right? So you get to choose which one you do, as long as you know about the risks. But of course, when the COVID vaccines came out, they were mandated within a few months of people making them. And then people were saying, oh, they're 100% safe. You heard this in the news all the time. All kinds of doctors said that. And I was saying, there's actually no friggin' way you can know if it's safe because they just made it like 3 months ago. There's no long-term safety data. There's not even any short-term safety data. When the myocarditis data started coming out, they started denying it. All the government officials, oh, it's not common. I saw all these doctors, oh, it's not that common. Oh, then it's not that serious. Turns out it can be that serious. People did have real problems. I knew 2 people myself, right? So there's, at least it's sort of a bit of a breath of fresh air. Like, yeah, maybe we should think about some of these things. I'm not saying that you should take any away or not any away. I mean, I think the mandates were actually a total disaster because by forcing them down people's throats when it was obvious that nobody had any kind of safety data, whatever, they were being mandated with the threat of basically losing their jobs, right? And that's something we've never done before. And to compare it to a measles vaccine that is, been used for 50 years is ridiculous, right? This is not only a new vaccine and a new disease, this technology for vaccine had never been used before. And anything that goes wrong, you can't sue anybody. You just get screwed. And I think people were like, yeah, we're like guinea pigs here. And I think that just trying to label him an anti-vaxxer is to miss the point that there are some real issues here that should be addressed. And if we don't address them, all you get is a bunch of people talking past each other without trying to understand what the actual issue is. And it's the same with the obesity drugs. I think there's a definite benefit to these drugs. I prescribe them a lot to my own patients. But I don't think that they're the whole answer. I think that there still is room for a lot of other things. But again, who's going to pay for it? How are you going to get paid for it? Why does most of the drug companies of the world make like almost all their money from the American public, and the rest of the world? Like, you go to India, you can buy the exact same drug for about, I don't know, 10 cents on the dollar. And when my patients go there, they're like, it's the same drug. It's all licensed. And then I look into it, it's completely licensed. It's licensed by, Pfizer, whoever, to the Indian manufacturer who sells it for like 10 cents on the dollar. They go there, they buy a ton of it, they come back to Canada. So why is the American public subsidizing it? All the profits of all the pharmaceuticals come off the backs of the American public. That's a good question somebody should ask. Why? Because the lobbyists are powerful. They take over, like, all the FDA governors go and work for the pharmaceuticals. The pharmaceuticals go and pay the doctor. Like, they take them out to fancy restaurants. Everybody knows that. Like, I can go, if I wanted to, I could go out to the fanciest dinner 3 days a week, paid for by the drug company. Everybody knows that. It's advertised everywhere. If I wanted to, I could take a fancy trip on the drug company's back. It's like, come on, that's all conflicts of interest. Like, drug companies are taking me out to, $300-400 dinners with wine and everything. That's what happened in the opioid crisis. Same thing that happening now with all the drug companies. Why is it even allowed? Like, why are every paper in the New England Journal, which is our major journal, it's like written by the drug company. It's even posted in there. The last article I looked at was written by the drug company, and they stuck somebody's name on it so that it looked good. Why are drug companies doing all the research? I mean, hell, like, if I said, oh, Coca-Cola did a study saying sugar is healthy, you'd say, get out of here, right? But now I say, oh, Pfizer, who makes this drug, says this drug is so good for you. Now, all of a sudden, that's evidence-based medicine. Now I'm supposed to take that at face value when we know that the whoever pays for the study it makes it like 10 times more likely that they're going to have positive results. Just like if Coke does a study on sugar, it's going to turn out that sugar is good for you. When the drug company does a study, it always turns out that the drug is good for you. And there's a million ways you can hide it, right? So I think it's good that somebody asks these difficult questions, because just to say that he's a quack is just taking the easy way out. It's not what we should be doing, because it's not in the American public's interest just to whitewash the problems that exist. Like, you've seen everybody's seen the data, right? American obesity is through the roof, right? Why? Americans are hardworking. Americans deserve better. Why do Americans have a decreasing life expectancy when the rest of the world is going up, even though they're spending 3 times as much? That's a good question that needs to be asked. And if you just whitewash and say, let's just do everything the way we did, it's like, no, we should ask these questions, because people deserve better than what we're giving them, which is, if a drug has a side effect, then the manufacturer should be liable for it. They shouldn't have a sweetheart deal. So
I agree.
I think that there's a lot of things there. Like, of course, he's not perfect. Like, he's got a lot of crazy ideas too. Like, I don't deny that, but there are some good questions in amongst them.
Fair enough.
Fantastic job.
You hit a couple of points there that I will want to follow up on. But first, I'm curious, Jesse, I haven't passed too much to you yet, so I'm curious if you have anything at all to add to Dr. Jason, Dr. Eric's, or even Yuri's points so far.
Yeah, so I think there's a lot to cover here, but I think one of the most important things that happened 4 or 5 years ago was with the advent of the COVID vaccinations and the mRNA vaccinations, we lost a lot of the public's trust in medicine. And that has had significant consequences. We've seen that people no longer want to vaccinate their children, no longer are, they're doing a lot of their vaccinations either off or not on time, or they're just completely not doing them at all. And that's why we've seen the spike in pertussis and some of the other things that they've mentioned previously. And the problem is those two are not the same. This new one is a completely different monster, just as Jason just said. The problem is the old ones that are tried and true, that have been there for years, they work. We know the side effects. We have tens of 20s of years of data to support those. Unfortunately, we don't have that with the mRNA vaccine and really many of the newer ones. And if you look at some of the laws that allowed to put these in place 20, 30 years ago, you wonder, why do they get basically a blank check, and why do they not go checked? Why do they have issues with not basically ever having to be questioned? Once that is available and mandated, they basically get a blank check, because most American citizens are going to get it from their insurance, and in some capacity is going to pay for it. But they don't have to worry about side effects. They don't have to worry about, am I hurting people? Because there's no ramifications to the manufacturer, which is bananas. No one can do that. That's not possible. Why do they get that luxury? And of course, we saw all of those stocks go down on the day he was announced, which is pretty crazy in my opinion. But I think it's a changing of the guard. Do I agree with all of RFK's comments and theories? No. But him and I think very similar in terms of the way we approach our own health. I run a clinic in Miami that has a lot of ozone and peptides and anti-aging, and then I do a lot of stem cells and stuff that is a little bit off the beaten path, but has been used for 50, 60, 70, 100 years. Big pharma and big insurance just don't want to talk about it and don't want to pay for it. And that's part of the problem. When you don't want to address the root cause, you just want to give people medications that are Band-Aids. And you never want to change why we're happening in the first place. So that I think will be something refreshing. Do I think half the stuff he's going to try to do ends up being done? I don't know. But I think he has an agenda, and it'll be interesting to see how it plays out. A lot of my patients come out of their way to find me and find people like me, because they don't want just to be handed another medication to take and say, hey, when do I need to take this until you die? That's not a treatment, that's a management. They're not getting to the root of the problem, because most of these meds are only addressing a specific cause, a specific thing. And that's part of the issue that I have with a lot of these. So I'm hoping a lot of that changes. Why are peptides banned? Most of you who don't know what a peptide is, Ozempic was a peptide 25 years ago, before it was ever Ozempic. These are small proteins that are in the body naturally. Our body naturally has well over 300,000 of them. And they are chemical signals that are being used in the body to serve as functions. Laboratories have basically identified, isolated them, and then basically recreated them, and they work fantastic. All the professional sports organizations have banned several of them because they work. The question is, why are these quote unquote banned? As of January, almost all of the major ones went from a class 1 or 2 to a class 3 regulatory status, and it made them very, very, very hard to get. Why? In my opinion, and I've heard some stories from people that are in the know, that basically said, because Big Pharma is in the process of evaluating several hundred of these to determine which one of them they're going to make into a drug. So they said, hey, lobbyists, shut this down temporarily as long as you can, so that we can get it competitive ahead. And that's basically what happened to Ozempic and Mounjaro and those. That's essentially what I envision happening, is that they'll come out with a medication version of thymosin alpha, which we use for immune system, and for PPC, which is great for healing, and PT141, which is great for sexual health, and there's other ones. And these are just small things that the American public that should deserve to know about, but are not covered either from an insurance perspective or from a provider perspective. And I think they need to focus on nutrition. We can't be eating all of these modified gluten, and why you can eat pretty much any gluten in Europe and Italy what you want, but you can't eat the same in America, because our gut can't handle it anymore. And all of these issues that are starting to cause a lot of problems. We're seeing turbo cancer. Unfortunately, I have several people in their 20s and 30s that have cancer already. Like, this is crazy. But unfortunately, some of our choices and some of our medications have allowed this, either directly or indirectly. A lot of the biologics, your Humira, Enbrel, all of those are addressing a specific problem, but unfortunately, they're going to lower the immune system's ability to fight infection. That's essentially what the COVID vaccine did, in my opinion, and that's why I see people with EBV and CMV and all these old chronic viruses that we've had for most of our lives. Now they come out and wreak havoc on our system because the body's immune system doesn't have the luxury of being able to put up a fight between, fighting what would be considered COVID in the form of a vaccine versus, all these other dormant viruses or whatever else we interact with in our environment. So it is refreshing. I have some concerns, obviously, to see how it will play out and if anything will actually be done. Big Pharma and big insurance have a massive stronghold on the American public from a financial perspective. And it'll be interesting to see if he can loosen some of those up. And the other thing I hope that he passes is we should not be allowed to have a television commercial about a drug. You should not be able to tell a lay person, this is the drug for you, if they know nothing about the drug and nothing about their condition. You need to leave that to the medical professionals who understand the differences between them, not because you're good at marketing. That's a huge red flag, and there's a ton of money that is put into that are paid billions of dollars every year for those advertising. And nowadays, patients are just going in and saying, oh, hey, I want this drug. They don't know anything about it. They don't know if it's good for them, bad for them. Why? Because my friend's on it, or I saw it on TV or whatever. Like, that's not medicine. That's just good marketing. But that's not how it should be. You need to go back to the roots and go back to the way it used to be, where you actually had time to spend with your physician. 10, 15-minute appointments are BS. This is ridiculous. And unfortunately, that's what it's become. Everybody has 5, 6, 7 doctors. Who wants to have 5, 6, 7 doctors that don't talk to each other? That's not medicine. That's not healthcare. That's sick care. And I'll leave it at that.
I think a lot of good points there, especially there at the end about being knowledgeable about substances being taken. I'm a former IRB coordinator, and so the concept of informed consent is way up there at the top of my list. There's a lot to unpack, both from Dr. Fung and Dr. Morse, that I want to get to. I want to touch a little bit more on that vaccine discussion before we move along. And Ken, I know you're new and you came in a little late, but I'm going to pick on you right out of the gate here by quickly touching on some more of that commentary around vaccines, specifically the supposed link between autism and vaccination, the claim there being that there's a direct link between vaccination and the development of autism. However, a study done in Denmark on quite a sizable population of over 500,000 participants, I think it was, found not only that this isn't true, but that there also seems to be an inverse relationship between vaccines and autism. Now, Ken, what could potentially lead folks to kind of believe in this relationship? Are we seeing kind of a disconnect between correlation and causation here, given the age at which symptoms of autism tend to manifest versus the age which certain vaccines are generally administered?
Yeah, I think what you're seeing here, thanks for having me, and I love the message that Jason and Jesse have been sharing. I think what you're seeing here is anytime the public is obviously misled, and that's what we saw. I think everybody's aware of this now. Even the lowliest grocery store sacker is aware that the messaging around COVID was obviously forced. The lobbyists were in charge. The big ad executives were in charge of this. Everybody feels that at a visceral level. They know that there was a lot of bullshit for the last few years around the COVID messaging. And there's always been vaccine denialists. There's always been anti-vax people, but they were always on the periphery. But when you've got now a huge chunk, a huge percentage of just regular folks who are now aware, man, there was a lot of baloney in that. A lot of that stuff wasn't true, but mainstream media pushed it as gospel. So if they lied to us about that, what else did they lie to us about? And then you've got this kind of fringe anti-vax contingency that now people are looking to them and they're like, well, maybe they're right. Maybe they're right about everything. Because I certainly don't believe that Fauci was right about everything. I certainly don't believe mainstream media was right about everything. And so there are many people who like a black and white message. And here's the anti-vaxxers who are like, yes, we have a black and white message for you. All vaccines are bad. They absolutely cause all these terrible, terrible things. Now, I completely agree with Dr. Fung. There's no perfect medicine. There's no perfect vaccine. If you give a medicine to 1 million people or a vaccine to 1 million people, there's going to be side effects. There's going to be injuries. There's going to be lawsuits, which absolutely should be able to be pursued. But we basically pull back the curtain starting in late 2019, that these people don't know what they're talking about sometimes being the key word. But what people hear who already maybe have a conspiratorial mindset, they maybe already, have read some anti-vax stuff. They're like, aha, see, all this is 100% bullcrap. And I think that I love it that RFK Jr. is going to be put in this role, because I think everything needs to be questioned. The big pharmaceutical houses have had their way with medicine, with the American media. They've literally had their way for the last 20, 30, 40, 50 years. Like Dr. Fung was saying, they literally design and pay for the research, but yet we're supposed to just believe that whole cloth. We're not supposed to question any little bit of that. But I think the COVID pulled the scabs off everybody's eyes, and they're all like, wait a minute. So I'm glad that RFK Jr., I think it's a good thing that he's got this position, because everything needs to be reexamined. Is there some tiny link between some vaccines and an increased rate of autism? Maybe. We need to look at that with fresh eyes. We need to go back and comb all the research. Do all vaccines cause autism at a very high rate? Obviously not. But has the rate of autism skyrocketed in recent years, recent decades? Yes, it has. Why? No one's asking the why question. And I think that's one of the beautiful things about RFK Jr. is he will ask why. Have we been led astray? Does a lot of this research need to be looked at with fresh eyes and a fresh paradigm? And I think that's exactly what needs to happen, because I think what we're going to find is that a large chunk of the accepted medical research is wrong. It may be wrong just a little bit, or it may be wrong a lot of bit, but it all has to be looked at with fresh eyes. And I think that's what this administration is at least voicing that they're going to do. Whether they actually do that remains to be seen. But I think that now is the perfect time for somebody like RFK Jr. to be in a position of authority where he can kind of pull back the curtain, and maybe he can show us definitively, no, this actually is true, what the big pharma houses have been saying. But also maybe he'll pull back that curtain and say, actually over here, these research studies are full of crap. This is not true at all. They massage the data. And so I think there needs to be a reckoning, but what's going to happen is neither side ultimately, whether you're talking about mainstream medicine or the fringe, kind of anti-vaxxers, naturopaths, Rockefeller was the devil and he ruined American medicine. Neither side is going to be happy. And I think that's going to be good, because that's actually what happens when reality rules the day, is that nobody's happy with that compromise. Everybody is sad because their side didn't win. But this is ultimately is not a battle of does big medicine win or does the fringe elements win. What we'd like to win the day here is actual reality. That would be awesome if we could kind of peel back and say, yeah, this is not true. And also this is not true. And everybody needs to kind of put down their childhood idols and say, okay, let's look at all the research in medicine, nutrition, and other places, and let's find out what was actually well done research that did not allow the researchers' preconceived opinions to leak into the research results, what research it was real and didn't allow big pharma's obvious financial motives to leak into the results of that research. I think that's what needs to happen on a nationwide scale, but obviously a global scale as well. But I think nobody on either side is going to be happy with the final result. if we actually look for what's the reality of this. And I think it definitely won't be boring for the next 4 years. And I think a lot of people are going to be unhappy, but that's often what happens when reality wins the day.
Thank you, Ken. Eric, I would like your take here as well on that 2002 publication out of Denmark following the MMR vaccine and the potential association of autism. Has there been any data since that suggests otherwise?
Well, first of all, everyone, I really appreciate your input. And as someone who has fought Big Pharma for many years, I was a former whistleblower against Vioxx, against Merck's Vioxx drug. I'm not a fan of Big Pharma, as anyone who knows me knows. But at the same time, I've conducted many clinical trials and long-term epidemiology studies, and it's not as some of you claim. And for example, even the indemnity clause, there's reasons, there's actual reasons why the indemnity clause was given for the warp speed vaccines, because of the fact that um, while they were doing the trial, we were ramping up production at the same time for them. And so the pharma, you guys want to talk about pro innovation, pro risk taking and innovation.
Let's
The
be very
reason that they had provided the
pragmatic
indemnity clause was
so we can
because
use just
they had
Oh,
asked them
one
to do.
moment, Eric. I think we have a hot mic in the background as well. Could everybody just double check microphones quick?
So, so basically, the reason that there was the indemnity clause was because we needed them to take the risk of mass producing and ramping up production in factories, all while the real results were still pending. This is how the warp speed vaccines were conducted, and that's how they were funded in order to deliver by the end of the year, even though COVID had just arrived. And that's the only exception of why it was you couldn't sue them, why they were given, or else they wouldn't start producing the vaccines while they're still being trialed. Okay, that was like the one time exception. And pharma doesn't do all the research because there's rules in which you have to give it to an independent academic researcher to conduct the analysis, even though there could be other co-authors who are from big pharma. I just want to put that misinformation, uh, dispel that inherent thing. And in terms of autism, there's lots of study that shows it does not increase a risk of autism. Pregnant mothers who got COVID vaccinated uh, did not have kids with increased risk of autism, um, and other long-term epidemiology studies. So generally, in evidence-based medicines, either clinical trials or long-term prospective epidemiology cohort studies. And that's what most of the medical literature is. And by the way, many other things were mentioned by earlier in this call that are alternative medicines that do not have either long-term trials with hard clinical endpoints or prospective epidemiology cohort studies with hard clinical endpoints. And that's why they're not usually endorsed by the medical literature. So that autism study was actually really good from Denmark because it's a long-term prospective cohort study of of these vaccinations, and found lower risk of autism. And they adjusted for many other things. And by the way, most things in nutrition are not from clinical trials. Most things in nutrition, as you know, actually comes from long-term cohort studies. And there's so many other misinformation I heard on this earlier on the call. I'm all for evidence based, but the person who's not evidence based is RFK Jr. He has pushed so many quack things. He denied AIDS, HIV, and AIDS. And if a person can deny that AIDS and HIV is caused by a virus, which is like ludicrous, what else can he deny? And for those who are not familiar with RFK, Children's Health Defense is literally one of the biggest disinformation organizations out there that he had founded. So, I'm all for giving a shot. Hey, America obesity, America healthcare system sucks. American health life expectancy sucks. We need to change things up. Yeah, I agree. At the same time, that will cost money. I'm worried about the healthcare cost cuts that we're going to see. that, oh, Fauci was wrong. Yeah, I've said many times Fauci was wrong, but I think he was wrong on different things. He didn't recognize asymptomatic transmission early enough. He didn't recognize airborne transmission early enough. He didn't recognize that the virus mutated to new variants. And so whenever people say, "Oh, the virus works, but then it doesn't work," oh, why doesn't it work? Oh, why didn't it stop in transmission? It did initially work really well. It's just the virus mutated. And so there's a lot of anti-vaxxers out there who are spreading misinformation. Oh, it supposedly worked, but then it doesn't work. Well, that's because things change. It's called a virus that mutates, and they try to confuse and conflate the and things. And also in terms of the risk, yes, there were myocarditis in terms of mRNA vaccines, but they're very small compared to the risk of myocarditis from COVID itself. And we're not like right now, in which COVID is at relatively low levels. We were in the midst of a very, very, very bad raging wildfire pandemic. And in those situations, the small risk of myocarditis is completely blotted out by the outstanding clear and present danger risks of myocarditis and many other, long COVID and COVID risks of COVID infection itself. And I think this is where, for those who just want to hand wave and mislead the public, it's very easy. Oh, they said it works, but it doesn't work. Oh, it stops transmission, but shouldn't, but now it clearly doesn't stop transmission. Yeah, things change. And I yelled at the CDC for saying those things, for being overzealous on the benefits. But I think we have to be, real, that not all of medicine is corrupt. Not all of pharma industry is corrupt. Yes, do they price gouge? Oh, yes, they price gouge. And yes, do they sometimes have bad scandals like with the Vioxx of hiding heart attack cases? Yes, but then New England Journal of Medicine and other journals caught them, and whistleblowers and other researchers found that they were dangerous. And so this is where RFK Jr., though, is at the fundamental level a liar of many things. He said so many things that he says that basically there's never been a vaccine that's been safe and effective. That's obviously ludicrous. He also claims COVID was ethnically targeting Caucasians and blacks people, while Asians and Ashkenazi Jews were protected, or were made, somehow relatively immune to the virus. That's also a nonsense from anyone who actually knows that. And and he compared vaccinations to the Holocaust, which is also ludicrous. And there's tons of other stuff with influenza vaccine, claiming it was caused by by the way, he claimed the 1918 influenza pandemic was caused by the influenza vaccine. It wasn't. It didn't even exist at that moment, basically. And there's so many other things where, we could trust a better guy. Now, obviously, we're stuck with RFK Jr., but I'm saying that the fact that there's so much misinformation, just because American healthcare system sucks, we shouldn't put our eggs in the full faith of a guy who literally denies that HIV and AIDS is caused by a virus, the HIV virus. And this is where, oh, you know, how bad could it be? Yeah, it could be really, really bad if we have these kind of outbreaks. And again, everyone who can have a vaccine can get an access to a vaccine. That sounds great. I guarantee you he's going to cut vaccination outreach programs in the CDC and elsewhere. I guarantee you he's going to cut a lot of vaccine research. And I guarantee you, he's going to try to cut the mandates for childhood public schools for children to get vaccinated to attend public schools. So all these things, you can say, oh, how bad could it be? And, we should give them a chance. I'm happy to give someone who's evidence-based in medicine and public health a chance, but RFK Jr. is inherently a clear and present danger on so many levels. And I'm all for nutrition, for those who are listening, because I'm a nutrition scientist as well. And I'm all for nutrition, but for him denying that, saying that seed oils is the cause of chronic disease, whenever we have, literally, millions of years of person year data from long-term epidemiology cohorts that we've been running for 30, 40 years that says seed oils do not cause, these chronic diseases. For him to he's saying that, I'm not confident in RFK Jr. leading nutrition research either. So this is where, like, he cherry picks what is evidence based. He denies the rest and makes up quack theories that's not supported by evidence based. But then somehow, oh, his supporters think that's perfectly fine. And this is where, he's not a reliable person who's inherently evidence based. He just cherry picks whatever he wants and denies and ignores whatever is inconvenient for him and puts out conspiracy theories that, like, basically confuses and the lay public. Oh, the vaccines don't work. Well, the vaccines did work, but then the virus mutated. And Fauci was wrong. Yeah, Fauci was wrong, but on certain things like airborne transmission early on and asymptomatic transmission early on. But he wasn't wrong on the fundamentals about how bad COVID was. And while RFK Jr. all the while was saying conspiracy theories about inherent genetic targeting of things and inherently, comparing to the Holocaust, and that's not in any ways evidence based. So I think that's where my general issues are with some of the topics raised here, but I'm all for revolutionizing American healthcare. I'm just worried that RFK Jr. is not the person in terms of being the standard bearer of good evidence-based healthcare to truly bring us there. All right, thank you so much.
Thank you, Eric. So I want to pivot here just a little bit to just deviate a little from disagreements we might have, which I do love because it really sparks conversation. It sparks more insight for the audience. Good discourse so far, very respectful, and I appreciate that from all of you. These things can kind of get out of hand sometimes. But what I want to touch on here, and this is probably something that, I would argue most more or less ethical medical professionals in the United States would agree with, is that drug pricing is kind of out of hand. The notion that big pharma focuses much more on profitability than on public health. And we saw that very clearly with the pricing of insulin, for example, prior to the fairly recent price caps that were implemented. Now, first, I'm wondering if we could actually see aggressive pricing reforms on drugs under RFK's HHS, given how outspoken he's been against price gouging in healthcare. And I'm also curious about how drug pricing reform might affect the biopharma healthcare markets in general. So Yuri, from your point of view here, should there be drug pricing reform? What kind of effects should be seen in the healthcare sector, and how should investors or fund managers in that sector kind of manage that should it happen?
Look, I think this is a very political and important topic. I think drug prices in the US are higher than the rest of the world. I think the drug prices are there in many cases to pay for the innovation. And I don't have a political view necessarily, but if you look at the example of, let's say, Japan in the 1980s, when they moved to regulate drug pricing, effectively they killed their entire biotechnology industry. Now, there's obviously trade-offs, and the prices are probably too high to allow access, and maybe there are countries that are piggybacking, maybe some countries in emerging markets, but also in Europe where prices are lower than in the US. But the thing that goes hand in hand with that is higher prices means a thriving biotechnology industry, which the United States is the undisputed leader of. Whether you look at Boston or California or all of these other places, also places where Eli Lilly is building campuses in Indiana and places like that. It's really a big testament to that the industry has come to this. Drug development is expensive, it's risky, it takes a lot of time, and to justify those risks requires some sort of reward at the end of it. And the price of the drug is that reward and the patent protection that comes with it. Now, in terms of drug price regulation, as we all know, the passage of the Inflation Reduction Act, IRA, introduced for the first time in the US the ability of Medicare to negotiate prices directly with the buyers. This hasn't happened before and makes absolute sense. The rest of the world negotiates, the government payer is a big buyer of pharmaceuticals. In some countries, it is the only buyer of pharmaceuticals. And therefore, it makes sense if you're a big buyer to negotiate prices. The mechanisms were already put in place with the passage of this act. Now, it was a disputed act. There were disputes on both sides, I think mainly related to the clean energy provisions within that act. But both sides, the Republicans and Democrats, agree that there should be some negotiation of pricing and that drug pricing should be brought under control. And as you saw, there were edicts about insulin pricing specifically. I don't think there's going to be massive change to the IRA system. The change that has come into the industry is probably going to be kept in place. There's probably going to be some extra rhetoric on drug pricing, but you have to ask the question, if the Democrats got into power, would it have been different? Probably worse. So I think in general, there's a perception that the government needs to deal with higher prices, and this is most acute, I guess, in the obesity space, because the demand for these drugs is so high. There is a need to reduce price to create access. The problem, of course, in the obesity space, as someone alluded to, is manufacturing. Supply can't keep up with demand. So even if you lower the price, you still wouldn't be able to give access to a lot of these drugs. So I think to take the balance view, I think drug prices is a very important issue. Drug prices are probably high in the US, but in many cases, they're used to pay for the innovation that's happened. We're big believers at Teman. We invest in drugs companies that actually provide real clinical benefits and innovation, not Me Too companies or things like that. And that innovation attracts patent protection and attracts pricing. Now, that pricing, of course, over time gets eroded once you have generics. So yes, the drug price might be high for a certain period of time, but we have regulations about genericization and biosimilars now, so the generics of biologic drugs as well. And that leads to a collapse in the price and all of those profits gone after a period of time. So the system is built there. I think there are definitely improvements to be made. I think for drug companies, IRA was an absolute negative in terms of this regulation for negotiating drug prices for the government. But as you know, the stock market, even a negative, once it's out there and known and unlikely to change, can be a bit of a clearing event. It was the same thing with the passage of the Affordable Care Act. There was a lot of problems in managed care and worries about what this might look like. But if you look at the way the market reacted to it, while there was uncertainty about how that reform would take place, the prices kept falling and the valuations got very, very low, similar to what we have today. But once that resolved and people saw that actually the Affordable Care Act was going to introduce a lot more coverage for uninsured Americans, but also other provisions, and companies learned to live with it, the share prices of many of these managed care companies rebounded. So from an investment perspective, I think what probably is going to happen is IRA is going to stay in place. It's a negative, but actually the companies have already started to learn to live with it. And will live under whatever regulation happens. And it's very important as an investor to be discerning in the space, to look for actual innovation, which should be paid for, because that's actually saving lives and improving patients' health.
Thank you, Yuri. So something I kind of want to talk on here also kind of relates to the markets in a lot of ways, and I'll pick on you again here, Yuri. Another appointment that's been going around, of course, by Donald Trump was Dr. Mehmet Oz, known for his long-running television show, Dr. Oz, wherein he's a pretty big proponent of kind of not necessarily commercializing, but keeping it to an industry standard in terms of healthcare. And he does, in some ways, promote universal healthcare for all, but does so through the scope of Medicare Advantage, which has some controversial drawbacks, such as further price gouging, which is already a large complaint across the board. But should things stay more commercialized, for lack of a better word, Medicare kind of gets dropped down by the wayside in the traditional sense, and Medicare Advantage becomes the primary selection of healthcare for most. What kind of connotations could you see in the healthcare sector based on that? Should prices stay higher? Medicare itself kind of falls by the wayside, while Medicare Advantage and more industrial-focused healthcare comes to the forefront. What do you kind of project there on the long term, Yuri?
Yeah, so obviously this kind of fits into the broader picture that Eric was talking about earlier, in terms of really understanding how how this all plays out, right? You have RFK in place as the health secretary, so the most powerful position, but actually at the different agencies, you have individuals who could be counterbalancing forces. I think there's still a question mark about Dr. Oz, how he's going to be perceived. He's going to head up CMS, which is responsible for Medicaid and Medicare. He has a lot of interest. He's a genuine physician. He's developed medical technologies before, and in many ways, we look as investors to people who have experience with the industry and understand how the lay of the land is. I think in terms of the question of Medicare Advantage, look, I think Medicare Advantage is really the private sector's delivery of a government program. So the idea is that you get insured by a private insurer, but the government effectively picks up the bill for you. And then there's also a transition point where you move from your private insurers to Medicare Advantage. So if you're insured privately, you move to Medicare Advantage once you pass a certain age. For those who don't know, Medicare covers elderly individuals in the United States for their healthcare needs. Look, I genuinely think there could be some conflict here in terms of who delivers the particular insurance, but there are checks and balances in place in the way the system has been set up to make sure that Medicare Advantage delivers the best for the patients and the government payer that ultimately foots the bill. Simply, this is a use of the private sector's existing insurance infrastructure in terms of relationships to hospitals, to pharmacy benefit organizations, to deliver that care in the best possible way with the government paying. I think ultimately the US system is very interesting and unique because there is a division between the healthcare provider and the payer and the insurance company as well. So there is an interesting, I guess, principal agent problems that you have in this sort of insurance situation. And those principal agent problems could start to creep in more if more Medicare is administered to Medicare Advantage. But Medicare Advantage, I think, is the dominant, from memory, delivery mechanism. It's just more efficient as its delivery. Ultimately, the US has implemented policies over the last many years, moving its healthcare system more to what other healthcare systems are in the world. More coverage for individuals under health insurance, more access to various medications and drugs. And the latest step is going to be probably more in that direction in terms of regulating drugs as well. So I think it'll have an impact in that sense. And we see as Dr. Oz, as well as the new nominated FDA commissioner, Martin Makary, as positive balancing forces, and as well as Vivek Ramaswamy at DOGE. So I think it's going to be an interesting environment where there are going to be multiple voices, but they're going to be counterbalancing forces to Kennedy if he is appointed.
And I know there were some voiced concerns around Dr. Oz as well, especially regarding the fact that some of the investments he holds are directly managed by the CMS that he would head. So, for example, I think it was like $600,000 that he had invested in United Healthcare, which is, I mean, a lot of the money there comes from the Medicare space. But to kind of wrap things up with this on the market side of things, Yuri, in terms of more of a long-term market outlook, like you were saying there in the healthcare sector, given all of this uncertainty, what will it take to kind of propel things forward, to kind of break through the uncertainty? Do we need, hardline policies to be implemented before that uncertainty dissipates? And if so, is there kind of a buying opportunity here?
So this is really interesting. Often when you have these dislocations, it creates an environment of uncertainty, and the best kind of returns in the stock market often made when you have a lot of uncertainty. And that's certainly the case for the healthcare sector. As I said earlier at the start of our conversation, healthcare is at a 21% discount to the rest of the market. So it's quite attractively priced, and it's priced at this discount we've seen previously in previous policy, let's call it Armageddons for healthcare. Now, what happens from here until, like, will this be a real problem for the sector? I think what will happen is we have to go through the nomination and appointment process. This can take some time, especially for Kennedy, and I think there's going to be voices in the Senate who have to approve this, unless we go for a recess approval, which is a very unusual move and unlikely, I think, to be taken. But this is where you approve candidates for important positions while the Senate is in recess. If that doesn't happen, you'll have to have hearings. And in these hearings, the potential nominees have to start to form a more coherent view of what their policies are going to be like. They're going to be under scrutiny. And we believe that during these hearings is probably when you're going to start to see the first semblance of the uncertainty lifting in this space. And that is going to happen at sometime early in Q1 next year, probably towards the end of Q1, actually. And there we're going to start to see some semblance. We've already seen semblance of norm with the appointments of the individuals to run CMS and the FDA. I think they've been taken positively by the market. They will be counterbalancing forces. The tweets from Vivek have been helpful as well. So we have early signs that things like innovation, which is really the heartbeat of our fund and the healthcare sector as well, will probably be undimmed. Now, of course, there'll be areas that are going to get hurt. I think vaccines we talked about a lot. It's unlikely that vaccines is going to be the area that I would be backing in terms of innovation. But if you look across oncology, cardiometabolic disease, chronic care, obesity, diabetes, all of these areas, I don't think innovation is going to go away. The other point to make here is deregulation. One of the big political agendas of the Trump administration is going to be deregulation. And that is also going to touch the health space and particularly the FDA. And that is generally seen as good for innovation. If we're going to see more drugs approved faster, that will benefit the space. And equally on top of that, you're probably going to see some deregulation in terms of the FTC's approach to mergers within the space. So if you start to layer these things, you can kind of see a path where there are counterbalancing forces now. M&A is likely to pick up into the end of the year as the FTC becomes a little bit less strict. You see companies realize, okay, the election's out the way, so I can start to make potentially moves with my capital. And then you have the deregulation drive driven by the Trump administration throughout. You could start to see an environment where healthcare innovation stays quite healthy or worse, neutral. And now you have the healthcare space at a discount. So, I'm not allowed to offer investment advice, but I think it's quite an exciting time to be a healthcare investor because there are lots of companies that are delivering genuine innovations for patients that will get paid for by the system because they're helping patients. And those are probably viable in a way. Just to round off, the healthcare sector as a percentage of the S&P 500 is the lowest it's been for 25 years. So that just tells you how out of favor it is relative to other sectors. And these things tend to adjust quite quickly once the policy uncertainty lifts, which think will start to happen as these hearings start to happen and actual policy gets put in place as well afterwards.
Thank you, Yuri. And Yuri mentioned that he can't give direct financial advice. Neither can we at Unusual Whales, but we can point you towards information. And I know very well that Thema ETFs is constantly publishing market information, data, information about companies, their earnings, their prospects. Yuri, where can people find these things on the Thema ETFs website to kind of stay informed on how your ETFs are functioning and what areas of the sectors you're looking at?
Yeah, absolutely. So you can head to our website, www.temaetfs.com. There you can find lots of information about our ETFs, especially the ones focused on healthcare. We have 3 ETFs. The one we talked about today, HRTS, focused on the cardiometabolic space. But we have 2 others, one on neuroscience and one on oncology, all areas of innovation we think will be intact in the current environment. And you can find lots of information. We write lots of articles about the space. We try to analyze what's going on, interesting developments, especially around GLP-1 drugs, oncology innovation, and other areas. We're going to be putting out our Outlook 2025 for the healthcare space in a couple of weeks' time. So look out for that. You can sign up for our newsletter as well. And you can get all of the information there also about the funds and where to invest.
Absolutely, check them out, folks. I've actually been following a lot of your guys' articles ever since you started sponsoring and coming on these panels. And I have to say, Yuri, having you here to give us these market insights to a lot of the uneasiness and a lot of the lack of clarity of what's happening going forward has been absolutely pinnacle to these panels. So I appreciate you not only sponsoring these panels, but actively participating and giving that insight that we might not have gotten elsewhere. So thank you, everybody, for coming today. And thank you, Thema ETFs, for making panels like this possible. I can't emphasize enough the information they're putting out. very helpful if you're especially new to investing and you're not sure what to look at. So definitely give Yuri a follow. Follow Tama ETFs on Twitter. Check out their website and newsletter. A lot of information there. And you can't go wrong having more information, folks. That'll wrap us up today. Again, thank you, Yuri and Tama. I hope everybody has a great rest of your afternoon. If you came in late and missed anything, don't worry about it. This will be published later this evening as an Unusual Whales podcast episode on both Spotify, Apple Pod, and YouTube. Thanks again, Yuri, and thank you, everybody, for coming today. Have a great evening.